Hello everyone. I am Mrs.Rohini Dani, Assistant Professor, Bharati Vidyapit, College of Nursing, Sangli. So today we're going to see in detail about under 5 clinic. So in the word only under 5 clinic, we need to give care those who are less than 5 years age. Under 5, mortality rate refers to the probability a newborn would die before reaching exactly 5 years of age, expressed per 1,000 live births. In 2022, 4.9 million children under 5 years of age died. And this translates to 13,400 children under the age of 5 dying every day in a 2022. So under 5, it is a special group, or which we can say it is a vulnerable group. So they suffers high rate of mortality and morbidity. So the effect of malnutrition and other diseases have role in later life. Means if the child is malnourished during the first 5 years, definitely he would develop the other problems in the latter life. The majority of the death are preventable through available intervention. Means there are nowadays many interventions are available, especially immunization is available. Through the immunization we can prevent many disease condition. This is a period of growth and development, so child is growing during the under 5, so we need to monitor this period. So there are lots of causes of mortality in the children's, like diarrhea, measles, malaria, pneumonia. There are lots of injuries in even neonatal, sepsis, pneumonia, asphyxia, congenital problem, preterm delivery, and even in the children HIV and AIDS. So under 5 clinic is a center where preventive, promotive, curative, referral and educational services are provided in the package manner to under 5 clinic under one roof. Means under a one roof, the parents or the those who are under 5 children will get the total care, means preventive care, promotive care, curative care and referral services also. The services are made available through trained nurses, so that not only the services become economical but also becomes available to larger proportion of children's population in the community. So here those who are trained nurses, they are only giving the care, preventive care, promotive care, curative care, and they can provide a referral services also. So there is a goal of under 5 clinic. Here, under 5 clinic is to provide comprehensive health care to young children in a separate specialized facility. Means comprehensive health care means here the child will get a total care, means physical, mental, then cognitive or the social. In all the aspect, total care child will get. The under 5 clinic is represented by traditional logo of the triangles with the 4 internal triangles inside and the outer enveloping triangles, which is showing in the figure. Means here, this is the first triangle. It indicates a care in illness. This is the second triangle. Here it indicates a preventive care. And this is third triangle. Here it indicates a monitored growth, and the inner one red triangle is the family planning, and outer one is the health education. We'll see one by one. First is care in illness. So in the care in illness, this is the felt need of the mother and the child for which any child is brought to the clinic. So whenever child is ill, he is not feeling well, or he is sick, that time the child will bring into the clinic. The parents are bringing the child in the clinics. The usual illnesses encountered in children under 5 are fever, diarrhea, acute respiratory infections, then infection of the skin and the worm infestation. Then the facility should provide for the essential laboratory investigation and the X-ray facilities, and the clinic should be backed by an effective referral mechanism. So here under 5 clinics, normal small diseases can be covered, and even there the laboratory services are also available, and X-ray facilities also are available in the under 5 clinics. Second point is growth monitoring. So here, this is the one of the most important function of the clinic. The child is weighed periodically every month during the first year, every second monthly from 1 to 3 years, and 3 years of age, and every 3 monthly in the 4th and the 5th year. Means during the infancy period, child need to bring into the clinic every monthly. Then in toddler period, 2 monthly, and in after that 4 to 5 years, every 3 monthly. So bedside weight, then measuring height, weight, height, mid-arm circumference can also be carried out depending upon the availability of trained manpower and the equipments. Means here the trained nurse is taking all the anthropometric measurements of a child, and which is plotted on the growth chart. The growth is plotted on the growth chart, and any fluttering in the growth is detected and suitable action initiated. The milestones are also recorded, and any delays also. So here the nurse is assessing the child, she is assessing all the milestones, and if the any child is having a delayed milestone, she can inform, and the child will get the treatment for that. Next point is preventive care. Here, under the prevention, primarily the immunization services during the first 5 years of the life which is very important. Vitamin A supplementation and administration of iron supplementation, and anti-helminthic treatment to prevent the anemia. The preventive care also provides for a regular health checkup and use of ORS during the diarrhea to prevent the dehydration from developing. So under preventive care, immunization is the important one. Through the immunization, we are preventing many diseases of a child, and which is very beneficial for the child also and the family members also. Okay. Then next is family planning. Here, family planning is the central to any program directed towards women and children. The mother are more receptive of the family planning during early puerperium and lactation, and mother is counseled on the various options available, and their merits and demerits, so that she can make a choice. So here, as a trained nurse, we need to explain all the contraceptive measures to the mothers. About all the contraceptives merits and demerits also we need to tell them, and the mother can choose which is suitable for her. She can choose, and we can help, as a nurse we can help her. Next point is health education. So here under the health education, there are lots of opportunity should made use to educate the mother on the issues of child care, breastfeeding, nutrition, then growth monitoring, immunization, and the hygiene of safe water and food preparation. Means here there are lots of topics on which we can give the health education to the mother or the parents or the family members, so child can promote his health, prevent the diseases. Okay, and especially in the advantages of breastfeeding, then complementary feeding, then how to assess the growth, then immunization, when to give, why to give immunization, then hygiene of a child, then safe water supply, food preparation, cleanliness. There are lots of things which through the health education we can explain them, and it will help to prevent the diseases and promote the health of a child. So here importance of under 5 clinics is prevention and the treatment of general diseases and injuries, and referring the critical children's, and providing health education to the mothers, and assess the growth and development of a child. Thank you.